This is Selma Schimmel, and you are looking live at the great city of Chicago, which is once again playing host to the American Society of Clinical Oncology, ASCO. This is ASCO's 49th annual meeting, and this year's theme could not be more appropriate: Building Bridges to Conquer Cancer. More than 30,000 of the world's foremost cancer specialists are here, and so is the Group Room, making our 15th appearance at ASCO and one of our very best. Joining me now is Dr. Lidia Schapira, Associate Professor, Department of Medicine, Harvard Medical School, Massachusetts General Hospital. Thank you for joining us today. Welcome to Humid Chicago.
Thank you so much.
With the growing dialogue surrounding palliative care, what role do you see it playing in clinical practice today?
Well, I'm certainly very happy to see that we can talk about it now, that we've become a more open culture, and that we recognize the need to integrate what we've now come to accept and call palliative care, which really in some way is good humanistic medicine, into all phases of oncology care, from the time of diagnosis to the more complex situations where perhaps pain, symptom management, existential despair, spiritual crises make the situation far more complex. Palliative care really refers to paying meticulous attention to the details of the patient experience, managing and honing in on the symptoms to make a bad situation a little bit better, to make the experience of illness more tolerable. And it attends not just to the physical needs, but also to the emotional, psychological, existential needs of the patient and his or her family, the caregivers who really need to be the object of our focus as well. I'm thrilled that we're talking about the care of the whole person and the family. That's what I understand palliative medicine is all about. And in this particular setting, that's where you really need to understand what matters to the person. And culture really is a lot of what that person's identity, values, aspirations, and beliefs are really all about.
And when we speak about the family members, the caregivers, even the friends, such an important role they have in influencing the patient. And patients also will respond and react to the spoken and unspoken attitudes and feelings that they're picking up from those around them. So sometimes patients try very hard to be gentle and caring about how other people are feeling, at the risk even of taking care of themselves.
You bring up these very important points. First, the importance of nonverbal communication. And I think that we need to be, as clinicians, really tuned into the fact that often the questions that are left unasked are important, that we need to look at the facial expressions, at the body language, and we need to really pick up on these cues and respond empathically and sensitively and appropriately to them. The other aspect that you bring up is the idea that patients or caregivers often want to protect each other, and they may want to buffer the bad news or buffer the experience. And so, again, you see all of these dynamics in the setting of a family meeting or even just an encounter where there's one family member present, and we need to really understand all of the different layers of communication that are going on. Patients often will want to minimize their symptoms so that their loved ones don't really know how sick they are, or there may be a loved one who's really depressed or not coping very well, and there may be some very interesting and complex interactions that need to be addressed if we really are going to come up with a comprehensive care plan that allows us to meet the medical needs and also the full needs of that patient and family.
And the issue also of significant others sometimes pushing the patient on when the patient may be ready to say, I'm tired, I don't want to do anymore. No, you have to fight. No, you don't have a good attitude. No, you've got to, you've got to, you've got to. And that's a really big challenge to overcome.
Absolutely, and I don't think there's one answer that I can give that would fit all of the scenarios that you describe, but trying to understand what the real worries are, the questions behind the questions, when somebody says you have to fight, well, what are you fighting for? What does it mean to you to fight? And what if nobody's going to win this battle if you need to put it in these winning and losing terms? So I think that we need to understand what people are saying. Sometimes the metaphors, the language they use help us understand. But most importantly, I think the real lesson in cross-cultural communication is never to make an assumption, to ask for clarification, to explore, to be humble, and not to assume that we know what people really are talking about because we've pegged them into an ethnic group, or we've made some assumptions about what's really important to them.
Thank you very much, Dr. Lidia Schapira, Associate Professor, Department of Medicine, Harvard Medical School, Massachusetts General Hospital. Thank you for joining us today.
It's my pleasure.